Hi, my name is Jerry Hesch. I'm a physical therapist at Hesch Institute in Aurora, Colorado. And recently online someone asked me to create a film discussing Inflare, Outflare of the pelvis. Oftentimes you'll read it in association with sacroiliac joint dysfunction, and the theory being propounded is that the ilium moves on the sacrum in the transverse plane. And if that's true, then the ASIS would come anterior and medial. But we have to realize that there's not been any research that has actually shown that when a client presents with what's called an inflare on the right and an outflare on the left, there's no evidence that that actually happens inside the SI joint. And maybe there's the most minute amount of movement in there, but there's a much greater range of motion available in the pelvis as a unit, moving with the hip joints and with the trunk. And I would suggest that oftentimes what we see and name inflare and outflare is actually just that. It's a gross movement of the pelvis. Nonetheless, we'll talk about how we evaluate that and how we treat that. So inflare again involves the anterior landmark, the ASIS, anterior superior iliac spine, moving medially towards the midline and anterior, also moving forward. And if we look at the pelvis from the back, if someone has this flare pattern to the pelvis, then the landmark in the back, the PSIS, posterior superior iliac spine, that bump, which you'll find very close to the dimple, that would move anterior and lateral. Now, it can be subtle when looked at from the back in terms of medial and lateral mobility, but when the client is supine, it can be more apparent that there's more soft tissue mass in the lateral pelvis compared to that on the left side. And some people measure it in relationship to the right ASIS being closer to the belly button, left ASIS more lateral. There is a passive mobility test done with the client prone in someone who presents with this positional pattern. And if you capture the PSIS and you spring it in the direction that that ilium flares at about a 45-degree angle, you'll notice that there's free and easy movement. But when you come and capture the left PSIS and you try and spring it laterally, there is resistance there in taking up the slack and resistance in getting spring and recoil mobility. So when someone presents with this motion asymmetry, the simple way of treating it is to have them lie prone, and you place a 2 by 4 by 8 inch foam roll or a firmly rolled hand towel or two of a 2-inch diameter and about an 8-inch length, and you place it under the hemipelvis vertically on the right hand side for 2 minutes. And then after that, what we do is we place it in supine, and we place it capturing the ilium and the ischium. So we want to capture that entire hemipelvis. So it's at a slight angle, perhaps a 15 or 20 degree angle, and we have the person lay on their back on that for 2 minutes. And after doing that, if we want to then capture the soft tissues that might be tight, then we can stretch the adductors in the right hip, stretch the adductors in the left hip, and I'll demonstrate that for you as soon as I reset my camera. So I'm the cameraman today. So the first soft tissue stretching for a right inflare would be to take the hip up to a 90-degree angle, and for some people you need to put a pillow under the ankle, but I'll demonstrate without it. And you just let the leg stretch out gently to the right. And you do that for 2 minutes. So you maintain this 90-degree of flexion at the hip and just let the leg fall out and hang as long as there's no pain. Most people tolerate it very well. After doing that for 2 minutes, then you bend the left knee up to 90 and you cross it over the body. It's flexed 90 degrees at the hip and it's crossing over to the right in horizontal abduction, and you capture the leg with your right hand and just stretch it very gently, maintaining the stretch in the region of the lumbopelvic region. You don't want to go really far all the way over. You want to focus that stretch on the area of the lumbosacral and sacroiliac and hip. And you do that for 2 minutes. For strengthening outside of the pattern, again, if you had a right inflare and a left outflare, then the lower pelvis basically orients to the left. And the upper body would have a tendency to counter-rotate in standing to the right. So you want to do the opposite. So you want to work on strengthening lower trunk to the right and upper trunk to the left. And so a simple one would be to do an oblique sit-up and do, say, between 30 and 100 reps 3 times a week. Now you will note that if someone presents with a flare pattern and you test their trunk strength, you will note that they are stronger going into that pattern because that's where the body already is positioned, and they will test weak or reduced endurance going out of the pattern. But oftentimes correcting that postural asymmetry can release inhibition of muscle, and then strength and endurance is much improved. So a little bit of strengthening over the course of a couple weeks could go a long way in reinforcing the correction of that flare pattern. And I recommend people do those exercises, those stretches, once a day for a week, and then after that twice a week for about 6 weeks. And that is the conclusion of my presentation on right inflare of the ilium and left outflare, which oftentimes is a postural pattern, a movement pattern with no evidence as to whether or not that truly involves the sacroiliac joint. Thank you very much.